My name is Dr. Arif and I'm your tutor for today. On this channel, we simplify medical knowledge from surgery, medicine, ops, gynecology, obstetric, and related specialities so that learning medicine becomes easy and approachable for everyone. With that said, let's jump to today's session.
Part 6 of Clinical Anesthesiology and Pain Management. Today we learn about total body fluid with its types like extracellular fluid, transcellular fluid, and intracellular fluid. Then the route of administration of IV therapy and setting of infusion rate and some important complications associated with inserting IV line. Then we study IV fluids in details like colloids, crystalloids, and blood products. Now let's jump to total body fluid. The total body fluid is 60% of total body mass. For example, a 92 kg male has a total body fluid of 55.2 liters, which becomes 60% of his body mass, which is 92 kg. Total body fluid is further divided into extracellular fluid, transcellular fluid, and intracellular fluid. Extracellular fluid, it is one third of the total body fluid. For example, one third of 55.2 liter of a 92 kg male is 18.4 liter. And extracellular fluid is further divided into interstitial fluid, intravascular fluid, and third space. Interstitial fluid, it is the fluid which is present between the tissues or between the cells, and it is 15% of total body fluid, and 15% of 55.2 liter of 92 kg male is 8.2 liters. So it is 8.2 liter interstitial fluid. Intravascular fluid, it is the fluid which is present inside the blood vessels, and it is calculated by 70 to 75 milliliter per kilogram. And a 92 kilogram male will have intravascular fluid of 6,440 to 6,900 ml of intravascular fluid. Third space is the fluid which is present inside the peritoneal cavity, pleural cavity, and pericardial cavity. So this is the third space which contains the fluid. Now, second type of the total body fluid is transcellular fluid. It is cerebrospinal fluid which is present in spinal canal and ventricles of the brain, synovial fluid which is present between the joints, and aqueous humor of eye which is present in the anterior and posterior chambers of eye, and it is 2% of the total body fluid. For example, if the 92 kilogram male has a total body fluid of 55.2 liter, then 2% of this becomes 1.104 liter. And the third type of the total body fluid is intracellular fluid, and it is two-thirds of the total body fluid, and that is two-thirds of 55.2 liter is 36.8 liter. And this intracellular fluid is present inside the cell. Now, how to give a rough estimation of the body fluid of the patient just looking at the patient? When we know this basic knowledge, then we can give a rough estimation of the body fluid. Muscle is rich in water and adipose tissue is poor in water. So if a patient has high muscle mass, so it means that the total body fluid in that patient is high. And if a patient has high fat mass, so it means total body fluid in that patient is low. Let's now calculate the amount of water needed for every 1 Celsius rise of body temperature. At normal body temperature, that is 37 Celsius, the daily requirement of the fluid is calculated by formula weight into 30 milliliter. For example, a 92 kg male at normal body temperature needs 2760 milliliter or 2.7 liter or round about 3 liter. Now, for every 1 Celsius rise in temperature above 38 Celsius or 100 Fahrenheit temperature of the body, the fluid requirement increases by 10%. For example, 10% of 2760 milliliter, which we calculated from the baseline water requirement at 37 Celsius of body temperature. Then for every 1 Celsius rise in temperature above 38 Celsius, the patient needs to take 276 milliliter, means around about 300 milliliter for every 1 Celsius rise above 38 Celsius for a patient having 92 kilogram. So now how to administer the IV therapy? The first one is peripheral line, means catheter is placed in the peripheral vein. Second is PICC, means peripherally inserted central catheter. Catheter is inserted through peripheral vein but placed in superior vena cava, as you see in the image. Peripheral midline catheter. The catheter is inserted through peripheral vein, but it is placed or it ends at the axilla. So that is that the end of the catheter will be in the axilla. Hickman lines. Skin is tunneled and then catheter is placed in the superior vena cava. Well, this is a very confusing topic for most of the doctors. How to set infusion rate? Now, doctors can order the infusion rate in two forms, like specific amount over specific time. For example, doctor says 500 ml over 2 hours, or doctor can order milliliter per hour. Like he can say that you have to do the infusion of this normal saline at the rate of 80 milliliter per hour. So this is how you should now set the infusion rate so that the doctor's order could be fulfilled. Now, before this, you should know about number of drops in 1 milliliter, and this number of drops in 1 milliliter is called drop set. In blood drip set, 1 milliliter contains 10 drops, so it is drop factor is 10 gatti per minute. GTT stands for Latin word gatti, which means drop. In regular drip set, 1 milliliter contains 15 drops. So the drop factor of regular drip set is 15 gatti per minute. And in micro drip set, 1 milliliter contains 60 drops. And drop factor for micro drip set is 60 gatti per minute. Now in first case, number of drop per minute when order is in milliliter per hour. Formula for this for drop per minute is that the milliliter per hour which is being ordered by the doctor into drop factor divided by 60 minutes. For example, doctor has ordered 12 milliliter per hour and drop factor is 60 gatti per minute. Then drops per minute is calculated and it is 3 drops per minute. Now how to fix number of drops per second? That is that you should divide number of drops with 60 seconds and it will be like in our case that when doctor has ordered 12 milliliter per hour, so there should be 0.05 drop per second. However, you can make it easy for yourself that after every 20 seconds allow 1 drop. When infusion rate is ordered in milliliter per hour, we are having in syringe pump. So syringe pump is the most reliable and most accurate way of setting infusion rate in milliliter per hour. In the second case, we have to calculate number of drops per minute. When order is in amount of fluid, that should be given over a specific time. Drops per minute is calculated by formula, that is the total amount of the fluid. It can be 500, 1500 ml. So whatsoever is the total amount of fluid, divided with, multiply it with drop factor of that specific drip set and divide it with the given time in minutes. For example, doctor has ordered 1500 ml of normal saline over 5 hours and drop factor is 15 gatti per minute. So formula for calculating drops per minute is that amount of fluid multiplied with the drop factor divided by total time, which becomes 75 drops per minute. And now how to fix the number of drops per second is that you should divide the total number of drops with 60 seconds and it will become that the answer will become 1.25 drop per second. However, you can make it easy for yourself that after every 0.8 second allow 1 drop. So this was how the infusion rate is being set. Let's now talk about some important complications as associated with passing IV line. Number one is infiltration, that is, needle enters the tissue instead of blood vessel, and this may lead to hematoma formation. So that's why you have to give a good compression when the needle is out. Second is phlebitis, that is inflammation of vein, and you will see all five cardinal signs of inflammation, such as pain, which is called dolor, redness, which is called rubor, functiolacia, which is immobility. For example, if it is the joint and the joint has inflammation, then you cannot use that joint. That joint is going to be stiff and painful when you use it. So that is called loss of function. There will be swelling, that's called tumor, and that area will have warmth, that is called color. So the third complication will be hypothermia. If large amount of cold IV fluid is given as infusion, this may decrease the body temperature, and hypothermia is defined when the body temperature is less than 35.5 Celsius or less than 96 Fahrenheit. So there are two terms which you should know the differences, and first one is osmolality. It is the concentration of solute in milliosmol per kilogram of solution, and when we want to define the concentration of solute in plasma, we use osmolality, and osmolality of plasma is 275 to 295 milliosmol per kilogram. And then on the basis of these, we decide either the plasma is hypotonic or hypertonic. Another term similar to osmolality is osmolarity, and it is the concentration of solute in milliosmol per liter of solution. So this was a brief difference between the osmolarity and osmolality. Now let's talk intravenous fluid in detail. There are three types of fluid which is given intravenously. One is colloid, crystalloids, and blood product. First, colloid. The solution has large molecules which remain in blood vessels and create high oncotic pressure, which draws water from interstitial and intracellular space. As you see in the image, you can remember it that colloids are having a large molecule and they are used in a small amount, and they draws water from the interstitium and from the cell. So it increases the intravascular fluid. But hypertonic crystalloids, we will discuss about this ahead in lecture, has exactly the same effect. So what is the difference of hypertonic crystalloid and colloid? Now, colloids are needed in small amount and they have longer duration of action because molecules remain in vessels for a longer time. On the other hand, hypertonic crystalloids are needed in large amount and they have shorter duration of time because they remain in the blood vessels for a short duration of time. So this is the only differences, and of course their indications are different on the basis of this fact. So colloids include 5% albumin or human albumin solution, hydroxyethyl starch, and polygellin, which has a famous brand name that is called Hemexil. Now, precautionary measure warding of impeding damage. Number one is elevate the head of the patient. Two is use large needle, for example, a thin gauge. And there is a mnemonic for remembering cannula of different sizes. So mnemonic for cannula color code and sizes are like center of the earth has orange lava and orange cannula has a size of 14 gauge. Soul is gray in color, so gray cannula has 16 gauge or is of 16 gauge size. Leaf of the plant is green and green cannula has a size of 18 gauge. Flower is pink in color and pink cannula has 20 gauge size. Sky is blue and blue cannula has a size of 22 gauge, and sun is yellow and yellow cannula has a size of 24 gauge. So you can remember cannula sizes along with this color with the help of this particular image. You can keep it in your mind and you can easily reminisce at the time of need. Second thing, that it increases risk of bleeding, means colloids increases risk of bleeding because it interferes with platelet function. there is high risk of hypervolemia or volume overload. So if hypervolemia occurs or volume overload occurs, then the signs are that the blood pressure increases, patient will have shortness of breath or dyspnea, you will hear crackles on auscultation, there will be generalized or pedal edema, and there will be pounding pulse. Or some patient may would show some hypersensitivity reaction to the colloid, so there is high risk of allergy. So take careful history. Either this patient had such reaction before or no. So if the reaction of if allergy occurs, then this is called infusion reaction. Patient may have fever, nausea, and headache, or patient may complain of flank pain, or pruritic rash may appear all over the body. That's called urticaria, which does not last more than 24 hours, or there may be bronchospasm, which leads to shortness of breath, or there is dyspnea on lying down, which is also called orthopnea, and this is because of pulmonary edema, or JVP may get distended. In fact, jugular venous pressure is the mean right atrial pressure, which is normally 5 millimeter of mercury or 7 centimeter of water, and this increases in case of fluid overload, right ventricular failure, pericardial effusion, or tricuspid valve disease. So here, if you just see that the JVP rises or JVP is descended, then think of this that it could be or it can be because of allergy to colloid. So now one type of the colloid had been 5% albumin or human albumin solution. So it is most commonly used, but because it is obtained from human plasma, so it is expensive. It is used for protein replacement, patient having hypoproteinemia, or increased volume to obtain hemodynamic stability in shock patient. Or there had been massive hemorrhage. So for obtaining hemodynamic stability, you give albumin. But there are some contraindications, that is that you cannot use the colloid or you cannot give colloid to a patient undergoing these conditions. For instance, anemia. Why? Because it dilutes the blood and it worsens the anemia. Set heart failure, because it leads to fluid overload, and the signs of fluid overload like high BP, dyspnea, crackles on auscultation, edema, and pounding pulse appear. Allergy to albumin, because albumin is obtained from human body, and if it is given with ACE inhibitors, then it leads to flushing and hypotension because it causes the release of histamine. So ACE inhibitors should be stopped 24 hours before infusion of colloids. The second example of colloids is hydroxyethyl starch. Now, it is less expensive because it is not obtained from human plasma, and their effects remain up to 20 to 24 to 36 hours. They contain sodium and chloride, so be careful not to give it to patients with hypertension. It is given after major surgery or major burn when there is huge shift of intravascular fluid or there is hemorrhage. It is used for protein replacement. Okay, it increases volume to obtain hemodynamic stability in shock patient. Okay, that was another one as well that we will don't talk about it. There's polygellin, which is also called hemaxil. It has a similar function as hydroxyethyl starch. So now let's talk about crystallite. Now, solution of the crystallite contains small molecules that pass through the cell membrane. Colloids were having large molecules and they were not able to pass the cell membrane, but they have small molecules and they can easily pass through the cell membrane, so they can appear either in the interstitium or inside the cell. So they increase fluid in intracellular space, interstitial space, and intravascular space. And there are three types of crystallites: isotonic crystallite, hypotonic crystallite, and hypertonic crystallite. Now let's first talk about isotonic crystallite. The composition of the isotonic crystallite is similar to the composition of plasma. So it increases fluid volume only inside the vessel, only in the intravascular space. But one should remember, When treating hypovolemia, then patient will quickly develop hypervolemia. Therefore, monitor for signs of hypervolemia like high BP, dyspnea, crackles on auscultation, edema, and pounding pulse. So as you see in the image, this is an isotonic crystalloid. The solution remains inside the blood vessels, and it does not interfere with the fluid present in the interstitial space or in the intracellular space. So it only increases fluid volume in the intravascular space. So how many different types of solutions are present in form of isotonic crystalloids? There are 0.9% sodium chloride, which is also called normal saline, ringer lactate, also called Hartmann solution, 5% dextrose in water, and ringer solution. So let's talk about some of the indications of these different types of isotonic crystalloids. Number one, 0.9% sodium chloride or normal saline. The concentration of sodium chloride in the solution is same as that of plasma. So it is used for vomiting, diarrhea, shock, mild hyponatremia, metabolic acidosis, for example, diabetic ketoacidosis, and first line for resuscitation. Now, contraindications, there is high risk of overload or hypervolemia in patient with cardiac or renal disease. So be careful when you are giving it to patient having cardiac disease or having CKD, means chronic kidney disease. Ringer's lactate, or also called Hartmann solution, it contains sodium, chloride, potassium, calcium, magnesium, and bicarbonate ions. Along that, it has dextrose, that is lactose. The composition of the solution is similar to the composition of plasma, so it is used for vomiting, diarrhea, fistula, drainage, burn, hemorrhage, hypovolemia due to third phase fluid shift like massive ascites, electrolytes deficient patient, and metabolic acidosis. So now question is, why metabolic acidosis causes hypovolemia? It is just like a chicken and egg scenario. Why? Because first dehydration occurs, which leads to acidosis. That is that the organic acids present in the plasma concentrates the plasma like lactic acid, and this acidotic state further causes volume loss. Now, some contraindication of Ringer's lactate. First one is lactic acidosis. If any patient having lactic acidosis, you cannot give Ringer's lactate. So it is obvious, it's something common sense. Patient with liver disease. Why? Because lactate is converted into bicarbonate in the liver. So if patient has liver failure, then this cannot be converted into bicarbonate, and accumulation of lactate leads to lactic acidosis. Patient with renal disease means it has reduced ability to filter out potassium, and this Ringer's lactate has potassium in it, so there will be high risk of hyperkalemia. Or patient with pH greater than 7.5, like metabolic alkalosis. Why? Because lactate is converted into bicarbonate, it worsens the alkalosis. The third type had been Ringer solution. So it contains everything except lactate. So it contains sodium, chloride, potassium, calcium, magnesium, and bicarbonate ions, but it does not have lactose. So it is used in the same way as Ringer lactate. So only difference is that contraindications related to lactate is absent. For instance, if patient has liver disease, so you can give Ringer solution. If patient has alkalosis, metabolic alkalosis, still you can give Ringer's lactate because it does not have lactose. But you cannot give it to patient with renal disease because still it contains potassium and it will cause hyperkalemia. The fourth type of isotonic crystalloid is 5% dextrose water. It is also isotonic, but when metabolized inside the cell, it releases water. So it is used to increase fluid volume in intracellular space, and it provides 170 kilocalories per liter, but it does not replace electrolytes. Instead, it dilutes plasma electrolytes. how it dilutes plasma electrolytes, how it start in causing hypervolemia. When glucose is used by the cells in glucolysis, then water of metabolism is produced. So it increases fluid volume in the intracellular space, and as well as this water diffuses to the interstitium and intravascular space and increase fluid volume in interstitial space and as well as in intracellular space. So that's why it dilutes electrolytes, and first it acts as an isotonic, but later on it turns into become hypotonic solution. So there are some contraindications related to 5% dextrose, which are that they increase risk of overload in cardiac and renal disease. In patients with high intracranial pressure will lead to cerebral edema. It should not be given in isolation because it dilutes the plasma electrolytes, because we already discussed that it produces water of metabolism, due to which it dilutes electrolytes in plasma. It is not used for fluid resuscitation because it does not stay in the intravascular space for a long time. It should not be mixed with blood because it leads to hemolysis. How it causes hemolysis? That is that it dilutes plasma, so it makes the plasma hypotonic, and due to this the fluid shift from the plasma into the cell, and it causes the swelling and bursting of cells. So this way it leads to hemolysis. And if it's given soon after surgery, while surgery being a stressful situation, then already ADH is released, which retains water. Then dextrose water adds more water of metabolism, and this leads to fluid overload. So if given soon after surgery, now due to stress, already ADH is released, which retains water, and then dextrose produces water of metabolism, and as a result of this will be fluid overload. So the second type of the crystallite is hypotonic crystallite. It means that the composition of solution is less than the composition of plasma. Now, fluid leaves the intravascular space and goes to interstitial space and intracellular space. So, it is used to hydrate cells in case of hyponatremia, diabetic ketoacidosis, and hyperglycemia. It increases fluid volume in intracellular and interstitial space, and it decreases volume of vascular bed. So in hypotonic crystallite, composition of solution is less, so fluid shifts from the intravascular space to interstitial space and then to the intracellular space. So why do you have to use it? To hydrate cell in case of hypernatremia, diabetic ketoacidosis, or hyperglycemia. In case we need more fluid in the intracellular or interstitial space, and it as well as because blood shift from the intravascular spaces and goes to the interstitium, so there will be decreased volume of vascular bed. So now there are some contraindications associated with hypotonic crystallite. Patient with high intracranial pressure leads to cerebral edema because it increases the intracellular fluid. In patient with burn, liver disease leads to hypovolemia because all the fluid from the intravascular space shifts to the interstitium, and then from the interstitium it goes to third space. In cardiovascular, and it leads to cardiovascular collapse due to decreased volume of vascular bed, because when there is cardiovascular drop there will be hypoperfusion, and cardiovascular system can't maintain adequate blood flow to the tissues and organ. Why? Because there is already decreased volume of vascular bed. Second, third, last type of the crystallite is hypertonic crystallite, and composition of the solution is more than the composition of plasma, so it increases fluid volume in the intravascular space and draws water from intracellular and interstitial space. We talked about the difference between the hypertonic crystallite and colloid. The only difference had been the duration of action and the amount needed. So hypertonic crystallite is needed in large amount, and it remains in the body for a shorter duration of time. As you see in the image, it draws water from the interstitium and from the cell. So the solutions which come in the form of hypertonic crystalloids are 3% sodium chloride, which is used for hyponatremia and cerebral edema, 5% dextrose with saline, which is D5NS, and it is used to replace sodium and chloride and provide calories. Contraindication is that it may lead to fluid overload in patients with cardiac and renal disease, and this overload may lead to pulmonary edema, and you can hear crackles on auscultation. So this was about crystalloids. Now let's jump to blood product. Spinning of whole blood at high speed leads to separation of its components, and it's called centrifugation. So components of whole blood which is achieved after centrifugation are PET, RBCs, and platelet-rich plasma. We will talk about their indications ahead in lecture. From these platelet-rich plasma, we can obtain two more components like platelet concentrate and fresh frozen plasma. Now, from this fresh frozen plasma, we can obtain cryoprecipitate when it is being thawed, and then a slushy material appears at its top, and this slushy material is separated by centrifugation, and this is called cryoprecipitate, which has WBC, factor 8, factor 13, and factor 1 in it. So now question is, when do you give this blood product? So indication of giving whole blood are acute blood loss, shock, exchange transfusion in neonate. And indications of PET RBCs are anemia, thalassemia, and leukemia. And indications of platelet concentrate are thrombocytopenia, major surgery, malignancy, and disease having decreased platelet function such as von Willebrand disease, Bernard-Soler disease, Glanzmann thrombocythemia, uremic platelet dysfunction, and or patient is using antiplatelets like clopidogrel, NSAIDs, and aspirin. There are some conditions where the transfusion of platelet is contraindicated, like thrombotic thrombocytopenia purpura and heparin-induced thrombocytopenia, or there is dengue virus infection. And indications of fresh frozen plasma are liver disease, disseminated intravascular coagulation, and clotting factor deficiency. And indications for cryoprecipitate are hemophilia A, von Willebrand disease, and fibrinogen deficiency. Thank you so much for watching this lengthy lecture till the end. I truly appreciate your time and dedication to learning. If you would like to download the complete handwritten notes of this lecture for easy revision, you can find them on my Udemy course and on the Teachable platform. Don't forget to check them out, and I will see you in the next lecture.